look at Well Life Foundation. Who is Well Life Foundation? Or what does Well Life Foundation do?
Okay, good morning, listeners. Happy to be here and for this opportunity to talk about Well Life Foundation. Well Life Foundation, it's a group of professionals that came together to look at how we can together contribute our bit. I mean, it's actually the group of Nigerian doctors who we thought over a period of time we've been in the field of medical practice, and we've seen that there's quite a lot that has to be done because in resource-poor environments like ours, if we leave everything to governments and the organized private sector, it's not going to work because there's so much. Yeah. There's so much to be done. So we thought, well, at this point, having had educations in Nigeria and everything, we believe it's time for us to give back to the society. And we've formed this foundation quite recently. And our goal is as much as possible to have health intervention services at various levels, from primary to tertiary care if possible, to see how much we can give back to the society. So basically that's what we are. Okay. We're just starting.
Interesting.
Yes.
So what areas are you more focused on at the moment?
Yes, because it's the problems are quite enormous actually. We're looking at 3 key areas. First, we want to look at the preventive health. Okay. Now in preventive health, we want to concentrate on some things like health education. It's amazing to hear that quite a lot of people are really not aware of so many tips here and there that people can do. For instance, even the prevention of malaria, for instance. Yeah. I mean, if you look at so many things, there are so many things that people can do on their own, but they're not aware to prevent malaria, as bad as it is, you know. So we want to look at that because that is a bit less of capital intensive. That's right. And it's just human resources we need to mobilize people here and there and go to communities and see how much we can give. Then beyond that, we also want to look at what we call the reproductive health, women health. Sadly, we in Nigeria generally we're still encountering a lot of maternal death. That's right. And that is an area that governments have put in so much effort. In fact, so many other bodies, organizations are still putting in so many things, but yet the results are not really so encouraging. So we want to see how we can come into that as well, and see how we can look at the various causes of maternal death and then maternal mortality, and then look at intervention areas. For instance, looking at our primary healthcare centers and see if those are healthcare centers at the level of the communities that we can liaise with, collaborate with, and see how we can prevent that. That's right. We have the various professionals that are involved in that. Now, the third aspect is, well, again, that is related to reproductive health. I'm sure infertility is a growing health problem now in Nigeria. We're seeing a lot. I mean, that's particularly, it's my own field. And we think that sometimes we see people at a point when fertility window is beginning to set on them. The sun of fertility this is setting on them, and that's when they're ready to do something, but it's already too late. So people have this erroneous belief that, well, at any time I'm ready to have a child, I will have a child. But it's never really like that, because all the available reproductive health technologies now, as far as medical science is concerned, cannot help everybody. And these people are not even aware of. And so it is important that we begin to educate people early enough so that, you know, if you ever have the intention to have a child, there's certain optimal age limit that you have to start. Interesting. Otherwise, when you get above that, perhaps you may not be able to help yourself, and no one may be able to help you. So basically, those are the 3 key areas we want to look at and see how much we can impact.
Oh, interesting. Yes. Now let's talk about the journey for Well Life. I'm sure something must have happened that triggered for this NGO to even come, to this foundation to start in the first place. So what has been the journey for you looking at, for example, you've mentioned a little bit that comes to women not preparing, but looking at the ratio, maybe let's say 5-10 years ago and now, what has really changed that's triggered you to, you know, put this as part of the things you're concerned about as a foundation?
Yes, well, in fact, so much has changed. Yeah. Particularly in our communities, in Nigeria in particular, so much has changed. Now, as regards to health, what actually triggered these recent experiences in practice, well, some of us have been in medical practice for about 23, 24 years now. In this number of years, we've seen quite a lot. Now, because along the line, somehow you see problems, it's not as if some of the things we're seeing here are new now. They've actually been existing.
Yeah.
And unfortunately, sadly, instead of probably even improving, they don't seem to be improving. And at some point in your life, you get to that stage, you ask yourself, well, instead of just seeing the problems, what is it that I, as a person, or as a group of people, can we really have an impact?
Yeah.
What can we do? So over time, actually, this has been in the pipeline, but of course, for various reasons here and there, it is just recently that we decided that, well, we're becoming really frustrated with the things we see. And so it is important that, well, if we all sit back and say someone else should do it, no, but I mean, we have to all put our own little bit to make sure that, yes, indeed, we at least contribute our quota to the problems. And perhaps instead of sitting down and complaining every day that, oh, this is bad, this is not happening, this is, well, we feel we should take the bull by the horn together and see what we can do. So it's actually as a result of experience of cumulative problems over the years that we decided, well, enough is enough from our own individual side as well as collective professional side. We believe that, well, it is time to do something now.
Now, for WellLife Foundation, who qualifies to be helped? Who qualifies for some kind of treatment? How do you bring out people that we know will get some kind of treatment?
Well, before now, we've also had some engagements at various levels with, we've been involved in some community services, at different levels, the outreaches and all of that. And over time, from our engagement, we saw that actually some of these community outreaches don't really solve people's problems. Because these are one-time things. Sometimes you go to a community and you are sad, you see quite a lot of medical conditions, and you can't really do anything that same day because you're limited by resources and time in your intervention. So you go to a community, for instance, you see a child who is malnourished. Now, your day intervention, what can you do about that child?
Good question.
Just nothing you can't really help that child at that point. Because you need some robust program that will say, first, make a diagnosis of what is wrong with this child. How did he get malnourished? But there will be a couple of problems there. Now, how do you follow up and see that your intervention is working? So what we want to do is, who benefits first is that, as I said before, we want to go to the communities and probably collaborate with local governments areas in the country and see at primary health care level what are the most demanding health needs. That's the level we want to. It's not going to be easy anyway, but then at that point we want to see who needs help first. Here we're looking at excuse me, we're looking at children's health, we're looking at women's health as well. That is the first criteria. So when we get to the communities, of course, depending on the resources at our disposal, we can pick out, we should be able to triage. We know who needs what most.
Who needs what, exactly.
That is the first. Then at some level too, at the city levels, for instance, we're looking at also infertility, infertile women, people who have had challenges conceiving. We've attended some programs recently. We've seen documentaries of what women go through when they have infertility. It's quite huge. And so we want to also collaborate with some other NGOs, if possible, to see if we can offer some free or some kind of subsidized health intervention for people who need some form of fertility treatment. So there we can, how do we know who needs? Of course we know, social class.
That's right.
And the stories we have when you actually go into the communities, you can know who is the poorest of the poor in that community and who needs what.
Who needs what, exactly.
Yeah, so basically that's what we intend to do. That's collaborating with community heads to know, okay, in this place we have limited resources. Who do you think? We have our own screening methods as well to know who should fit in for what.
Okay.
Yes, that's what we're
now, so is WellLife Foundation open to people just walking up to maybe a hospital and say, I can access your services? How do I access it? Or we have to invite you to a particular community for us to access it?
Yes, well, so far, of course, because we probably our resources are limited.
Yes.
We can't say that, okay, every facility. We hope that along the line, hospitals, health centers will be willing
Yes.
to go with us to the extent that at some point we can say, yes, we have partnership with social health facility under the Health Wildlife Foundation. You have an identity card or something. You can go in there, access health care, and then the foundation takes the bills. When we get to that point, but for now, we have a hospital that it's the platform, okay, where we're trying to see how we can, of course, use that hospital to offer some of the services we intend to offer soon. But then that wouldn't be enough.
That wouldn't be enough.
It won't be enough because if you look at Nigeria as a whole, of course, one center cannot take care. Of course, how do you get someone from maybe, let's say, Akwa Ibom to Abuja to a health center when he or she cannot even afford transportation, or from the far north and all of that? So we want to spread our tentacles as much as possible, hoping that people will also be willing to collaborate with us and see how much we can give.
Because I'm just wondering, somebody might be listening right now and they would really want to collaborate. So how do they access or what contacts so that they'll be able to reach you?
Yes, we actually, to some extent, we're also online. We also have social media handles.
Awesome.
Yes, so once you go to Wildlife Foundation, you will see some of the things yes.
Okay.
So if people, those who are willing to collaborate, they can contact us through their phone numbers. There are also websites that they can contact us through.
Okay, so if you're listening right now, and I think this is a very noble cause for any Nigerian who can to be able to support. You might want to say that I'm supporting Wildlife to be able to handle my community. Maybe your village, maybe not necessarily in Abuja, and you want Wildlife to follow you to your community and offer these health care services. You can go to Welllife, WELL, Welllife Foundation. So are we on Facebook, Instagram?
Yes,
which of the? Okay, so Facebook, Instagram. Just go there and just drop your interest to partner, your interest to be able to support this foundation. And I don't know, this is so unscripted. It will be nice to have Welllife, run a program on radio on awareness. So we could do some kind of collaboration, to
great.
make that happen.
Great.
And see how we'll be able to just make the communities aware.
Yeah.
Like you said, as in quote, as little as malaria is, it could be, a big deal if we don't take care of ourselves and all of that. All right. So before we wrap up this morning, I still want Dr. Ayaz Yakub, to shed more light on what's the next step for Welllife, so that the person that wants to partner will know what is next, to look forward to it.
Well, of course we're ready and ready to go as far as we can.
Yes.
Well, of course we guess what the limiting factor is resources, basically. So as soon as people are ready to collaborate with us, just to contact us, we're just a phone call or Instagram or whatever page away. So as soon as we see readiness, of course, on our part, we've already started certain things according to the resources we have. But as soon as, for instance, anybody who is interested, as you said, to collaborate with us and gives us his plans, of course, we're ready to go as soon as possible.
Okay, so before we wrap up, I would like to quickly, Doctor is still in the studio, so you can call us right now. Maybe I can leave the phone lines for us to take one or two contributions. 090-9705-4450. That is 090-9705-4450. That number, you can send your text messages or your WhatsApp messages. But even if he leaves the studio and you still want to, because collaboration is what will make it easy for us to be able to move to the next level health-wise as far as the Nigeria's health is concerned. And you can also call us right now if you want to call and maybe ask him a question directly. We don't have much time, so you might need to do that as quickly as possible. 090-8766-8888. 090-8766-8888. So you can call right this moment and take those and make your contributions so that we can take those as quickly as possible. So while I wait for those messages, now before I let you go, Doctor, now let's look at the issues of in the city center now. Do we have health challenges maybe in the city centers as well as the rural areas?
Of course we do. We do as much as perhaps the rural. It's just that the nature of the challenges are quite different. While at the community levels we have what we call the primary health.
Okay, so hold on. Let's pick this call. Hello. Good morning.
Hello. Good morning.
Good morning. Please tell us your name.
Good morning.
Can you tell us your name and your location, please?
Yes, Mrs. Daniel Blessing.
Okay, Mrs.
Calling
Daniel
from
Blessing.
Airport Road.
From Airport Road. Go ahead, ma'am.
Yes, ma'am. I wanted to ask a question concerning the infertility issue.
Please go ahead. Go ahead.
Okay. So there's a problem that there are some who find a case that they don't see their period, like what's the cause of changes of period, like we don't set the date, like in a month, one might see her period for twice. So I don't know the cause, and there's this issue. I think like my sister, I'm calling this particularly because of my sister. She got married for like 2 years and she's not giving birth. So going to the doctor, they said they should run some tests, and running some tests still up to now there is no any result shown about it, and she's bothered. So I want to know the cause of the infertility. Is it for the infection? Because she treated infection, but see yet.
Okay, so we'll just let him respond to that. Thank you so much, Mrs. Daniel Blessing. So it's like you already entered the awareness part of Well Life. Well,
Yes,
you're already
well,
here,
yes,
so
yes,
we will not let you go. Just help a
That's
sister.
interesting. Yes, that's interesting. Well,
Yeah.
basically from what I heard, she said her sister has some menstrual irregularities.
Yes,
and
irregularities.
they've probably
Yeah.
gone to hospitals and she's been checked already, and they don't seem to know what exactly is happening.
Yeah.
Perhaps what I would say simply is that, well, of course I won't be able to tell exactly what her own problem will be, except if one was to have a consultation with her. But what I would suggest she does is this: it's better. Sometimes people are going to the wrong places. You know, it's better to go to the right place. If it is fertility, there are a couple of centers in around Abuja that do fertility treatment. I think if her concern is basically infertility, she should look at one of these centers where that she knows are actually registered as infertility clinics, and that's the best place she will be able to be evaluated properly, and then her treatment plan will be elucidated. But otherwise, now seriously, I haven't seen her. I have not
So
interacted.
there's no one answer that fits into
Not
all.
at all.
Yeah.
Not at all. There are over 1,000 problems.
Wow.
That one person.
Yes.
So it's not possible to
Okay.
say in her case this is
It's actually past our time, but I asked you a question earlier, so if we can just look at that on the issue where do we have issues in the city centers like in the rural areas, and you were trying to respond to
Yes,
that.
in the city centers we have as much as for instance, I can tell you in our experience, sometimes we have, it depends on what you're looking at, from child health to women health. We have children that occasionally get abandoned in hospitals because their parents cannot afford care in cities, in the city of Abuja.
Wow.
We've had such experiences before. We've had women who are abandoned by their husbands at delivery because they can't pay bills.
Wow.
So we have husbands that run away simply because the wife has twins, because he feels he can't afford it in city centers.
I actually deliberately asked that question because I want somebody to know that you can actually support Well Life in the city center.
Yes, exactly.
It was actually deliberate that I brought that up because
Thank you so much.
you might be thinking, your family is not in Nigeria, or you're not a Nigerian, and you don't need that healthcare. But I tell you that even in the city center, there are people who actually need healthcare. And so if you support what Well Life Foundation is doing, you are changing somebody's life.
Definitely.
You are changing somebody's destiny.
Definitely.
Totally.
Definitely.
So please support what the Well Life Foundation is doing. If you need more information, you can send me a message on the Eagles FM line, and the doctor will get all the information he needs from us. 090-9705-4450. That is 090-9705-4450. And if you are someone that has always wanted to, just put your little gains into healthcare, I don't know, but if I'm sure if Doctor has the kind of support, they might want to, just start a program on awareness on Eagles FM.
Sure.
And we can go a long way, in doing this. So what are your final words to us as Nigerians?
Well, as Nigerians, I want to say that we should stop complaining all the time. Because it's sad that some of us believe that we can make it in Nigeria, we can correct the things in Nigeria, but it's a very sad thing. It's a sad reality we face outside, especially among the young people.
Yeah.
And that's the reason you see a lot of people with the so-called Japa syndrome. But I believe that if, as Nigerians, we're to sit down together, by the grace of God, God has given Nigeria resources that we can harness together. But we have to do it together. Collectively, we should be able to solve our problems. So on our part as Well Life Foundation, we want to look at the health aspect. There are so many other problems Nigerians are facing today, and which, of course, if we have professionals in the various fields that are ready to take their own beat in their professions, I believe that, of course, Nigeria will get better.
Thank you so much. Thank you, Dr. I.S. Yakub, for coming from Well Life Foundation. You can go to Facebook, Instagram, look for Well Life Foundation, find out a little bit more. Sometimes we don't want to support because the organization might not be legit. Yes. They are here because they are legit. I tell you, I promise you that. And so if you want to have a Well Life, touch lives out there, send us a message and we'll definitely get you, Doctor, on board so that you two can just sit down and see how to be able to change the lives of either children or women in our communities. 090-9705-4450. And if you know an organization, we have been live on Facebook and YouTube on Eagles FM Abuja, so you can share the videos and let's spread the word of the kind and noble acts that Well Life Foundation is doing. Thank you so much, Doctor, for coming.
Thank you so much. Right. I really appreciate it.
You're welcome. All right, just still remain sitting. All right, so what we will do is we'll take a musical break. At 9 o'clock is the Quizard Show. Please stay.
All the liars are calling me one.